Good morning, everybody. It really is a great pleasure to have been invited. The Patients Association is really wanting to work very closely with nurses and all other healthcare colleagues. Now, I wasn't going to say this, but the competition gene in me was sparked by Claire, who's one of 6 children, and I'm one of 13 children. And all gifts from God, my mother said. There were some masses of disadvantages in that, and the major disadvantage, I have to say, is growing up in a small town, Northern Ireland, amongst colleagues, other children my own age, who were from much wealthier backgrounds. Instilled in me very early, even though I couldn't say the word justice or injustice, but I discovered at a very early age about injustice. And as far as I was concerned, that was about people who had more money, had more clout, more friends, more this, more tennis rackets at school, no worry about paying the £6 a year school fee or whatever. And I don't know whether or not that was what drove me into nursing. It was probably not helped by the fact that I was such a bad student. I left school at nearly age 18, partly because of railing against the social injustice, but I had 2 O-levels to my name, which was such a disgrace. But once I qualified as a nurse, I then did my O-levels, A-levels, and went on eventually to train to be a barrister. So any parents among you, and I number myself among this, who've got children who are really dragging their feet coming up to GCSEs, they may not just be ready for study at the moment. I think there are some nurses who are just not ready for compassion sometimes, which is probably why we need to have some of the clear guidelines in place to make sure that people do step by step learn what care is all about. One of the key aspects, all of the 6 C's are really important, there's no doubt about it. And courage is one, and as people were giving anecdotes, it reminded me that one of the most difficult times in my life was as a student nurse, discovering one of my colleague nurses, who was a 3rd-year student nurse, I was 2nd year, leaning over the cot sides of a patient who had contractures, who was very, very disabled, but mentally was with it. And her husband used to come and visit her a couple of times a week. And I remember this nurse, this is one of my colleagues, as a nurse who'd had the same training and similar sort of background, leaning across and teasing this elderly woman and telling her that she, the nurse, was going out with her husband that evening to the pictures, and that's why he wouldn't be in to see her. Now, it was one of the most shocking things I ever saw, and I remember actually saying to the nurse afterwards, but it took me 2 nights of not sleeping to approach a senior colleague and say that I thought what she did was so bad. I did 2 days later pluck up that courage and said very gingerly, I'm afraid if you ever do it again, I'm going to have to report you. And she did do it again 2 weeks later, exactly the same thing. Your husband will be coming in tonight, he's taking me to the pictures. I dropped what I was doing and went to the matron's office. We were in a very isolated care, it was called a geriatric hospital, and reported the nurse to the matron of the time. When I went into the matron's office, the first thing she did was threw me out of her office because the apron you couldn't go to see her without a fresh apron on, whatever the cause. I went back to the nurse's home, got a fresh apron, came back to her. And I did actually see a spark of compassion in that matron. The nurse was actually sacked. A 3rd-year student nurse was sacked. My life was made hell for the next 3 months after that. I was in an isolated area and a lot of my colleagues wouldn't speak to me. I have to say the only thing is I did sleep at night better than I would have done, but it gave me these bags under my eyes, and underneath the L'Oreal there is grey hair, and that helped spark that off. And one other episode which required a great deal of courage, I discovered when I was in a senior position, a number of senior consultants had arranged for their medical students to carry out vaginal examinations in unconscious women without their consent. It was apparently rife practice at the time, and a nurse came to see me, a student nurse, who was horrified at it. When I went to investigate, sure enough, it was happening. And again, the bags got deeper and the hair got greyer when I had to face 6 consultant obstetricians and gynecologists and tell them that I had discovered this and it was totally unacceptable. And I was assured that I needn't worry because staff were not part of the practice. And I said I wasn't at all reassured, but I was also aware that private patients weren't subject to the practice. And after a considerable battle, I can tell you, we did end up with no women having vaginal examinations without their consent. Yes, doctors have to be trained, but human beings have to be respected, and that was, it was actually battery in law. So, sorry, enough about the anecdotes. The Patients Association is an organisation which has been running now for 50 years. Some of you will remember Claire Rayner. She was one of our more well-known presidents. We are absolutely delighted that Robert Francis has now been appointed as our new president, and he's very keen to be actively involved, and we worked very closely with him over the Mid-Staff's inquiry. We also have our chief exec is a nurse, Catherine Murphy, and Rosalind, we have another trustee who's a nurse. Jo Brand is one of our vice presidents, a very experienced nurse. So it's not patients attacking nurses. One of the things we all realise, having been experienced nurses, is that nurses are not the monsters that patients sometimes ring us up and complain about. And with some of the stories, let's face it, you will agree with me that it's not surprising that some patients are terrified of nurses. Now, this is a day of being positive, and thank God this campaign is taking place. I know that I've seen some of the tweets and the comments from some nurses saying, this isn't going to work, why don't people come back down to earth? Criticisms of the Care and Compassion campaign. I have to ask, what is there to complain about with the 6 Cs? Which of us would argue with the rightness of those various elements? One of the things that I'd like to talk about briefly is the Patients Association Care campaign, which complements absolutely the Chief Nurse's 6 Cs. And the Care campaign has 4 elements, and it's about communicating with compassion. It's about ensuring that there's adequate intake of food and fluid. It's about ensuring adequate relief of pain. And it's about assistance with toileting, and when you do assist a patient, that it's done with dignity. That's based on, of the thousands of inquiries we get every year, these are the things that patients or their relatives complain to us about. And where I think they fit in with the 6 Cs is it's taking the compassion and the care elements down, drilling down into those. And it's one of the things that we are very keen to work with. We're already working with many directors of nursing and trusts. We already, for a small fee, assist trusts with complaint handling. It's a major problem, and getting it right is not easy. We have developed a formula that Robert Francis promoted and applauded, and we are willing to provide assistance for trusts with their complaint handling. We are in 600 trusts signed up to the Care campaign, and we're now going back each year, finding out how people are responding to that. And we've had some very good responses, and you'll see on our website some of the excellent examples where people have promoted and made changes. One of the most encouraging, I think, is the hourly ward rounds, patient rounds, actually going to see. What a marvellous thing. It's so simple, it's so straightforward. Yes, it's time consuming, but actually going and asking every patient every 1 or 2 hours, how are things? pain, etc. It doesn't have to be the director of nursing, of course, but having somebody who has that responsibility. I'm not going to say much more except to say that a number of the people who've responded to us say there are 3 barriers to them making this better. Inadequate finance, what's new? It is a real problem and it has got to be addressed. Too few staff. I know that there is another initiative which the Patients Association is involved with, is how many staff are actually needed. Safe staffing levels. And probably the most difficult is in relation to the inability to change the culture in large organisations. It really does need to be the person and the people at the top who set the tone. If you've got a senior nurse making little of patients or throwaway comments that are derogatory to patients, bet your life on it, that culture will permeate right through the system. Now, I know no one would do that deliberately, but we can communicate a lot in our body language. We're working with the CQC in terms of inspections, and we need to make sure that we don't throw the baby out with the bathwater. We want to work with all of you and with doctors and healthcare assistants. One of the last things I would say is there are 650,000 registered nurses and midwives in the UK, but there are more than 800,000, we don't know exactly how many, non-registered carers, healthcare assistants, and it is one of our campaigns to get those people registered and regulated. Healthcare assistants are often looking after the most vulnerable people in our societies. It's not a big deal to bring about the regulation, but it is something that we really want to promote. Your job is easier if you know that the care assistants in your employ are regulated. They haven't been struck off the nursing register. There are all sorts of ways that we can work together, and we very much look forward to working with you over the coming year, and hopefully we'll be back here with you next year, to celebrate further success in this field. Thank you very much indeed.